Right, good morning, everyone. Thank you once again for joining us. It is Monday, March 29th, and it is once again a great honor for us to be here with you for another episode of your weekly show, the ALG Weekly. And today we come to you for another community member, another community leader, somebody who's been with the African Leadership Group for a while now and has been doing a great job for the organization and for the community. We have Mr. Abdul Pesimer. Abdul is a health and wellness committee member. He's also a member of the board of directors. So we have one of our bosses here today with us. But without further ado, let us introduce our guest. Good morning, Abdul.
Good morning.
Thank you for joining us.
Thank you.
Thank you. So this is your second time on the show. I think if I'm remembering correctly, you may be the first one to appear twice on this show. So that's a first. But tell us a little bit about your involvement with the African Leadership Group, and then your involvement with the African Leadership Group.
Well, I've been involved with the African Leadership Group for some time now, and practically been involved more in the health and wellness community. And what we have been doing is that we're trying to see how we can create awareness about the health of community members, especially those who are hesitant in going to see their doctors or going to the clinics and all of those kind of things. And for last year, we were involved in a lot of things. Last year was the beginning of 2020. It was about the beginning of COVID, and so we were involved in the COVID information, and we created a program where we were involved in COVID information. We were also involved in COVID tests. We did a lot of tests around right here in our offices, at ALG offices right here, and also we are involved in the flu shots. So the ALG Health and Wellness Committee is mostly trying to create a lot of awareness regarding the health of community members.
All right, great. Thank you. And then I know you were the only one who were able to join us today as a member of your committee, but we also want to extend a thank you to all the committee members who have served with you, Sharma and Cassandra, Jusu, and I'm forgetting someone.
And Natwa, we have Natwa, we have Pascal.
And Pascal. So yeah, just wanted to thank all of them from the African Leadership Group, but also the whole community for the service that you guys are doing. But yeah, we are here today, as you said earlier. We've been in this pandemic for about a year now, and we have done several events, starting with the COVID informational forum that we did early when the pandemic hit, and then we followed that with a free COVID test that we hosted here at the African Leadership Group, and then I think back in November we did the flu shot, and today. Since then, a lot has happened. As a community member and someone who's involved with the community, with the African Leadership Group and your church and your work and your everyday work, what have you seen in the community concerning the COVID-19, how people have adapted to it, or how it has changed, and then we thought we were out of it, that it was finally gone, and to now we having the vaccine and everything. What are some of the things that you've seen within the community?
Well, one of the things that we've seen is that a lot of community members are practically involved, especially in trying to keep their health, be healthy, and trying to follow all the laid down regulations and principles that helps to keep us safe from the virus, COVID virus. So we want to thank God for that, for the fact that people are practicing, the distancing, trying to wash their hands, and trying to be healthy, practically be healthy. But one thing that we also have to thank God for is the fact that we do have a vaccine now. But we do recognize that there's a lot of hesitancy, among community members as well as other people, immigrants especially. They are very, very hesitant in going out and taking the vaccine. And that's what we we want to talk about today, and that's what we are trying to organize to have the people that will come in and talk about it, the vaccines and the importance of the vaccines, the essence of us having the vaccines.
All right. Thank you. So I guess then my question is, because we've seen the problem. We know that the problem is there's a lack of trust, right, between especially in this country when it comes to minorities and the public health, and especially black and brown people, as well as immigrants, and specifically African immigrants do not really trust the health system. So. Coming from the community and then working in the healthcare system as well, do you have an understanding, perhaps a unique perspective, given that you are in this community as well as being in the health system? Does that give you an understanding of where that mistrust may come from, or where it is rooted?
Well, the mistrust is something that has its various views, I think the one of the views that they have is the aspect of mistrust from many years ago in the black and brown communities, and also for us, the African immigrant, or specifically immigrants per se, they are also afraid of what's going to happen to them. Some of them are afraid to just go to the hospital or go to the clinic. They are also afraid. And some of them don't even understand, some of these things that's going on around. So we need to do a lot of education regarding that.
Thank you for that perspective, and I think the education is the key point of it, and that's how we have to overcome that mistrust. So coming to this event that we have on Saturday, April 3rd, this being the first event of the Health and Wellness Committee for the year 2021. How was the need seen? Well, obviously the need is there because we need to provide education, but is the community ready for has there been any talk for you being a leader within the community and the church, and has there been anything specific as far as the vaccines goes? Is there any questioning that you've received about the vaccine, its legality, its efficiency, or even if it is safe? So the safety of the vaccine. In your personal experience, have you received any questions? Is there anybody that has come up to you about those things?
Yes, we do have some people that have been questioning the way it was done. They are saying that it was too fast. And because they are aware that vaccines takes a long time for it to be produced and then finally implemented as such. But so some people are questioning that. Some people also have some kind of theories. I don't know what kind of theories is that, but some kind of different kind of theories about it, and that it's from somebody's DNA, or all kinds of things that the people are putting up these days, that we need to do a lot of education. And that's one of the reasons why we're having this program on April 3rd, Saturday, April 3rd, beginning at 3 to 5 o'clock p.m. in the evening, in the afternoon or evening, so that we can be able to educate people, we can be able to pass on information, and we can be able to make people be aware of the vaccine and the essence of them taking the vaccine.
Good. And we are doing this event with partners, as we say here at the African Leadership Group. We are open for partnership if everyone who is working in the community or wants to work with the community. Partnership is something that we are always looking forward to, and this is your committee is actually one of the committees that's always been in that practice, and I think all the last events that we've put together, it's actually been in partnership with Stride Health. We've been in partnership with the Colorado Black Health Collaborative, and then in this event specifically, we'll be in partnership also with the City of Denver, and then the Colorado Public Health, as well as the Colorado Health Foundation. So talk to us a little bit about how the partnership with these different organizations came in, and what's the importance of these partnerships?
Well, we always need to work in partnership. I think ALG believes in partnership. That's what I would say. You know, all of us at ALG, we believe that we have to collaborate and cooperate with others in order for us to be able to have what we want, you know, in terms of education, in terms of passing information in terms of resources. So we do need partnership, and we really thank God for the partnership that we have with Stride, the partnership that we have with the Colorado Black Collaborative, and of course the partnership that we have with the Colorado Department of Health, also public health. Those are all very, very important partnerships that we have developed, and we want to continue on with that. And we know that they will be able to help us in giving information out to our people, and also being able to find resources for us so that our people will be able to have their health.
Yep. Yep. And then so for people who are maybe looking to participate in this event, or even register to participate, the registration link is open. You can find that on our website. It is at usalg.org, usalg.org. You can also find the link for that in any of our social medias, that Facebook, Twitter, and Instagram. So if you are looking for a way to register, those are the ways you can register. You can go to our website, once again, usalg.org, or you can just go to Eventbrite and look us up, African Leadership Group, and that health and wellness event will show. So for people who perhaps may not be may still not trust the COVID-19. You have taken it, the vaccine. Can you tell us a little bit what was your experience taking the vaccine, and afterwards, were there any after effects for you? Did you feel dizzy? And how long was that process, if anything happened after you taking the vaccine?
Well, the first vaccine I took, I think sometime in January, early January or so, and it was okay. I was feeling okay, you know, for that very first vaccine. I had a little bit of, I think, fever, but it just went away when I took Tylenol. So that was okay, that first one. And the second one, I had some fever during the night. You know, I took Tylenol again. It went away. And then the next day after I took the second vaccine, I did have some pain, you know, a lot of pain, you know, and my whole body. It's as if I was hit by a truck or something, you know. I spent most of the day in bed. But after that, is the very next day after that, it's like I had so much energy. You know, I was able to accomplish all the things that I wasn't able to accomplish for the last few days that I was, you know, the day that I took it and the next day that I was in bed. I was able to accomplish everything 2 days after, I would say, you know, but I had a lot of energy, and since then I've not been having any kind of reactions or anything like that to them.
And since then you haven't had any effects or anything that?
No. No, since, I mean, I do COVID test every week anyway, but no, I've not had any kind of thing, positive result.
And so that's actually interesting that even after taking it, you're taking the test, even after taking the vaccine, because there may be a lot of, and as you know, if in our community, we have a lot of WhatsApp doctors, a lot of WhatsApp journalists that the theories, there's a lot of them, and there may be some misinformation. So you can still have the COVID, you can still test positive after getting the vaccine.
I don't know about that. I mean, what do I know? I mean, I think probably this question is for the CDC and those other doctors who are in the medical field per se. But I mean, I'm doing COVID tests every week because of what the people that I work with and the people that I go see on a weekly basis. And so some of those facilities are requesting to see a COVID test every week, even though they do know that I've already taken the COVID vaccine. So because of that, that's why I'm doing it. So I'm not too sure whether I will ever have it or not. I hope I don't have it, ever have it or not. But so far I trust it. So far I do trust the vaccine, and it has worked for me so far. Thank God for that.
And so I guess then in that same alley, you are still being careful with your surroundings, even after taking the vaccine, wearing your mask. I saw you coming with that. So even for the people out there who have taken the vaccine, it is important for people to still pay attention to those things, even though they may have taken the vaccine.
Yeah, I think that's very, very important, especially for family members or people who have not taken the vaccines yet. It's always good for us to be careful. Just be careful, about things, and to try to protect them. I might be okay now as such, but I don't know about my next door neighbor. I don't know about my some other family members. I don't know who's there that I will meet in the community or on the places that I go to that is culpable, towards the virus. So I just have to be careful about all of this kind of things. So let's make sure that I keep myself okay, and also help other people to be okay.
Would you recommend taking the vaccine? I mean, you've taken it, you work with this, that's an obvious question, but taking the vaccine, going through the couple of days of pain and all that, would you recommend people to take the vaccine?
I would recommend that everybody takes it. Those who are qualified to take it right now. I hope everybody will be able to take it. Everybody will be qualified to take it, and that's what I'm looking forward to. Wherein we'll be able to offer it not by stages as such, but everybody to open it up to everybody to be able to take it. Who wants to take it, take it. I will recommend that people take the vaccine.
All right, great. Well, I guess those are some of your questions have been answered, and if you have more questions that may be more technical or, as he said earlier, for the doctors. So we will have doctors, we will have people who are practicing every single day that will be present at this event on Saturday. So it's Saturday,
April 3rd.
April 3rd from 3 p.m. to 5 p.m. It will be via Zoom. The information will be sent to you once you have registered, and it also, again, the registration is available through our website, usalg.org. It is available through all of our social media channels. That is through Facebook, Instagram, and Twitter. You can find the link to make sure you register. Otherwise, you can just be in contact with us, USALG, info@usalg.org. And if you do have questions, we are taking questions actually before the event for anybody who may have questions that you want them to answer. So to make sure that people are getting to your questions, because at the end we'll have time for Q&A. But just to make sure that your questions are answered, you can send them to us ahead of time. And if you can't make it for any reason, you can also send us your questions, because those questions that may not be answered at the event, we'll actually send them to the panelists so that they can answer them and send them back to us. And those questions will later be posted on our on our website here at the African Leadership Group. So Abdul, thank you so much for coming in today. Please pass your thanks to the rest of the community. We greatly appreciate your work. But just any last message about the event on Saturday, and what word of wisdom do you have for the community?
Yeah, I just want to remind you guys that it starts at 3 o'clock on time. We are on time, 3 o'clock on Saturday to 5 p.m. Please make some time to be able to be there with us. It's on Zoom. It's going to be on Zoom. We're going to be having the mayor of Denver, who's coming to talk to us a little bit about what he is doing in his city, and regarding this COVID vaccines and all of that. We also will be having Dr. Terry Richardson, coming in from the Black Collaborative Group, that will be talking to us also about the vaccine. And people also from Stride. We're having somebody from Stride, 2 people actually from Stride, that will be talking to us a lot about the vaccines and everything that's regarding the vaccines and the virus. Of course, we also will be having somebody that's representing the Colorado Department of Public Health. So please make sure that you are there on Saturday. I'm looking forward to seeing you on Zoom.
Thank you, Abdul. And as you may have pointed it out, so this is it's your one-stop point to get everything that you need as far as it goes. You can get your information from citywide. The mayor of Denver will be there, so you'll know exactly what the city of Denver is doing at the city level and what exactly the mayor and his staff are doing and what are the steps that they're taking to make sure that the vaccine is available, and they'll also talk about the availability and the timeline. It will also be the same thing as far as the state level goes. We'll have a representative from the Colorado Public Health, Department. So make sure you are there. It's a one-stop where you can get all your questions answered, from city level to state level, all the way to the scientists and the doctors who are there every single day. You'll get information about the vaccine, how the vaccine was made, and how the vaccine works. We'll also get information about COVID, because it's still something that's new, and as well as the variants. We'll know about how the COVID works. So we'll get you all the information that you need, and it will be one stop for 2 hours on Saturday, April 3rd, from 3 p.m. to 5 p.m. And yeah, so this will be all for your show today, and we'll see you on Saturday. Saturday from 3 p.m. to 5 p.m. Aside from that, this month we'll also see you on April 19th for our legal clinic. Our legal clinic is on April 19th. The link for that will be coming out soon, and then you can register for all these events that I just listed on our website, usalg.org. So thank you so much. We'll see you next Monday, and have a great day.
Thank you. Okay. So one thing I'm looking forward, done right?
We good, yeah.
Okay. One thing I'm looking forward to is the getting the vaccines to everybody, not limiting it to the stage of the stage.
I think they're doing that with the community organizations. So I know.